the order with which our doctors are actually dealing with these problems is a setup for a recurring system that keeps patients coming back over and over again. How many people have mast cell activation syndrome, histamine intolerance, a lot of food allergies? Type in chat.
Me.
Type in the chat. Samantha's one of them. Okay. So in looking at this, okay, a mast cell is one of the white blood cells. And on these white blood cells are little receptors there. These little satellite looking things are receptors. What happens is if there's food particles that your body doesn't like, I'm not talking about the obvious anaphylactic stuff that you go to an allergist for. We're talking about food sensitivities and food intolerance that they cannot figure out. Okay. It would take hours to days for these symptoms to show up. So how the hell would you know it was the broccoli you ate 3 days ago? You wouldn't. This is why I had to create food mapping, because these things are hard to figure out. But let's say for this person, it's broccoli and sesame. Okay. So when these particles come in here, these receptors really activate a whole cascade of events on these mast cells, and they release a lot of histamines. Now, I'm going to blow your mind and tie this together with a lot of your symptoms, and you're going to see connections that you've never heard about. Okay, so this is a good slide to take a screenshot on. This is a good time to take some notes. I put these concepts into something visual. I think it's really important. So a lot of people see these histamines and they think it's just an allergy problem. They think the histamine pathway only hits allergies. Okay, and so people think ear, nose, throat, mucus, asthma, right? And believe it or not, the allergy symptoms increase histamines. Some people will also increase histamines in the gut from food will cause diarrhea. Histamines causes swelling in those blood vessels, which will cause you to have an upset stomach. It'll cause swelling in the intestines. Guess what that happens is the diarrhea. So some of the symptoms there. But look at what else the histamine pathways does. So cardiovascular. How many of you guys have POTS, dysautonomia, dizziness, vertigo? How many? Type in chat right now. They don't know why, and I'm here to tell you why. Can I just tell you why? Can I please tell you why? Did you know that when you have elevated histamine coming from food in your gut, when it circulates in the bloodstream, it causes your blood vessels to dilate, which then causes what to happen? Blood pressure to drop. Ooh, it's not a heart problem. It's a gut problem. And it's a histamine problem for a lot of people. And they are sending you to the cardiologist to tell you your labs and tests are normal. Okay. There is a histamine pathway to the cardiovascular system. And not only does it cause blood pressure to drop, it can cause it to fluctuate up and down. Even those of you with high blood pressure, this can be a problem. It's not just low blood pressure, but it's also high blood pressure. And the other thing is, guess what happens when your arteries dilate? Your heart starts to try to pump more blood. So it goes through tachycardia, fast rate. How many of you have fast heart rate? And you know it's a response sometimes to eating food, and you can't figure out what those things are. Well, it's not in your head. You're not crazy, because there's literally a scientific pathway between histamine pathway and cardiovascular system. So the underlying cause of POTS is autonomia, dizziness for people, blood pressure changes, tachycardia is what? Can be food sensitivities that you have no idea about, that they dismiss as unreal. This is why I had to create the food mapping system for this purpose, because these are real and the pathway is straight from histamine to cardiovascular. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. And guess what else it does? How many of you have skin disorders? How many of you have lichen sclerosis, psoriasis, seborrheic dermatitis, eczema, right? Samantha's raising her hand again. It's related to her skin issues. These histamines will cause all these problems with the skin. And then guess what? Inflammation. Histamine pathway causes the pro-inflammatory pathways for pain, increases substance P, causing a lot of pain. So how many of you have nerve pain, neuropathy? How many of you have had joint surgery and joint pain? How many of you have TMJ, shoulder problems, right? Carpal tunnel. How many just hurt? How many of you have fibromyalgia? And you know it's related with food. Well, there's a direct pathway from food sensitivities to create histamines that directly causes pain to be worse. It's not just about your gut. This is about pain, people. And then let's go over here. Guess what? The histamine pathway causes pro-cancer pathways. So people who are chronically elevated in histamines with a lot of food sensitivities are what? At higher risk for almost every type of cancer. Because high histamines can cause increased cancer risk. So in all the fight for cancer, all the research for cancer, all the money's being thrown into chemotherapy and radiation and treatments for cancer. Why aren't we preventing it by removing food sensitivities from us and our children to prevent that cancer in the first place? Oh, we do. We do. I do. People I work with do. It's preventable. And then look at uterus. It increases estrogen. Data actually shows histamine causes increased estrogen in painful periods. Those of you who swear that food and your heavy periods are linked, certain times of the month, or drinking alcohol related to worse hormonal symptoms, this or that, like there is a link between what you eat and the histamines and the amount of estrogen and other hormones your body's making and breaking down. So it totally impacts hormonal health. It's not a little thing, it's a big thing. All right. And so Samantha's story here, I'm tying it back. I'm bringing it back. What I'm going to tell you is it's not only her digestion, all right, that is causing poor digestion, poor fermentation, right, could cause a lot of her hormone imbalances, right? But now the food allergies, digestion and food allergies are linked. And these food allergies are triggering her to have these hormonal symptoms, these allergy symptoms. She has skin issues, infection, right? And so I'm bringing it on home. They're all linked with a walk around the circle. And I didn't even go into central nervous system people with histamines, with autism spectrum, ADD, depression, anxiety. And Samantha, you said some of your symptoms was anxiety and panic attack. I'm bringing it at home.
Yeah.
Related with digestion, related with high, low blood sugar, triggering anxiety. Now related with food allergies, food sensitivities causing what? Central nervous brain hormone changes. Histamine can actually interact with your brain to change the levels of brain neurotransmitters like dopamine, norepinephrine, epinephrine, and serotonin. Is every single one of the symptoms that Sam just talked about, are they connected? Do you see how looking at her digestion and her gut health was related with this? How it would impact her blood sugar, the amount of hormones she makes, and the amount of fat that goes in her liver, right? That would help cause hormone breakdown problems. Could you see how digestive problems would cause nutrient densities that could cause chronic fatigue and even anxiety? Right? Could you see how food allergies in her is linked with her having mast cell activation syndrome, is linked to hormones, linked to infection that she's talking about, the gut dysbiosis that she has? Can you see why her hormones are effed up? That's a walk around the pillars of transform. Her problems could be solved in a very short period of time. If people did every single one of these steps, the 5 pillars of transform is everything that we do in our transform fundamentals program. Right? So it's every one of these. To me, the content of every one of these is critical for you to be educated in, for you to know what to do, because your doctors stop begging them. They don't know this. And number 2 is also order really matters. I bet you she's been sitting here going to a functional or naturopath trying to deal with this gut dysbiosis over and over again, and it just won't go away. Am I right, Samantha? I don't know this history. I'm just asking.
I've been too scared to try because I was afraid that I'd have a really bad reaction if I addressed the infection
She could, because
first.
she's allergic to everything with mast cell, right? And this is
Yeah.
where order is really wrong out there. I love the idea, and this is a huge value, everybody, is that order really matters, and write that down. Infection should never be tackled first. It's the victim of everything else wrong around the circle. Okay, it's the victim. So you keep treating the victim, but you never treat any of these other causes. And then you're going to be spinning yourself over and over again, thousands and thousands, tens of thousands of dollars trying to kill SIBO, trying to kill H. pylori, trying to kill these infections, dealing with Lyme, when the problem is everything that led to the environment that caused those infections to come and stay and recur hasn't changed. This is where order freaking matters. And so the worst thing that Samantha could do is go see somebody who says gut is first, infection first, which is what 99% of functional docs are going to do. And I'm sure she's seen some of those. Have you?
Yeah, as soon as he did like the oats test on me,
Yep.
the organic acid.
Oh, infection's your biggest problem.
Yeah, and then like my serotonin was low and all of that from it. So he's like, "Here, let's give you a bunch of berberine and a bunch of oregano oil."
Kill,
And I
kill,
was like,
kill. Well, she has mast cell and can't tolerate a lot of supplements and food anyway in the first place. Let's kill some shit.
Yeah, and it was like an aggressive dose too. And I was like, I can't do that and be able to function and take care of my 3 toddlers. So I just never started because I didn't get that good feeling to, try to kill all the infection. He's like, just take some activated charcoal, you'll be fine. It's like,
No,
oh,
you
I'm
won't
good.
be, because no, he didn't address your he or she did not address your digestion, didn't address your blood sugar, never did food mapping with you to identify which foods was triggering this problem. And, there's just, the list goes on and on. So the order with which our doctors are actually dealing with these problems is wrong. And it's a setup for a recurring system that keeps patients coming back over and over again. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.